The Koch network is pushing to expand a personal option for Americans geared toward the private sector healthcare agenda in response to Democrats' push for a public option, which would give people a chance to buy into a government-run healthcare plan.
So CNBC reports the Americans for Prosperity, part of the Koch network, engaging with lawmakers of both sides to garner support for its healthcare agenda. Joining us now to discuss, President of Center for Health and Democracy, former health insurance executive Wendell Potter, to discuss. Good to see you, Wendell.
Good to see you too, Seger.
So we've got a bit of a clip for you to react to. Let's put it up there, the ad that they're touting, and we'll get your reaction. Let's take a listen.
Colorado is more than a state. It's a state of mind. Here, we each do things our own way. And yet, state politicians want to create a one-size-fits-all government health insurance system called the state government option. It gives politicians greater control over your health care, threatening the coverage you already have and increasing costs. It's time to tell politicians we cannot afford the state government option. Learn how at coloradoshealthcarefuture.org.
Really interesting, Wendell. What did you think?
Well, it's not surprising that Americans for Prosperity would be touting that ad, which if you look at the last part of that and read the screen, you'll see that it is from an organization called the Partnership for America's Healthcare Future, which is a front group for the insurance industry and big hospital chains. And they're spending millions of dollars, not only in Colorado, but in other states. And we'll be seeing similar ads showing up all across the country and certainly in Washington. Those campaigns, by the way, are based on what I used to call FUD. And when I was in the insurance business for 20 years, we used to create ads like that are intended to instill fear in people, to make them feel uncertain about what's being proposed and to doubt that what's being proposed is in their best interest. These are fear-mongering campaigns, and they often are very effective.
Yeah, so we've got a couple of elements here, Wendell. You've got that ad campaign to scare people out of anything like a public option. Then you have them putting forward their own plan, calling it the personal option. What do you make of this dual track effort, and what do you think of its chances of success? Because we have seen these ad campaigns and scare tactics work very well in the past.
They can work because they spend a lot of money. There's a lot of money behind these ads, these campaigns, and we've seen how they have been successful in states where Americans for Prosperity are particularly impactful, like my home state of Tennessee. It's one of the states that has not expanded the Medicaid program. There are 11 other states that have not. So they're very influential. I don't think necessarily the personal option which they're advocating will resonate very much. Certainly not with Democrats, but I don't think with a lot of Republicans either. It's what some years ago some folks were referring to as a personal responsibility brigade. And that is, it's your responsibility to find private health insurance. And if you don't, then you're just shirking your individual responsibility. It does not work that way in health insurance. And we need to have some government involvement in our healthcare system, or the insurance industry will revert to its old ways of deciding who they want to insure and blackballing those they don't want to insure.
So here's what I'm interested in, Wendell, just kind of switching gears a bit, which is this all preemptive? Because, yes, Joe Biden has said that he would go for a public option, but there's been no public messaging indication from the administration that that's even within the cards of what they're going to fight for. So is this entire conversation moot? Like, do you even think the Biden administration is actually going to try and do something major legislatively on health care?
I actually do. I think it may be months down the road. It could even be into next year. But understandably, I think the focus of the administration and Congress has been getting this relief package signed and the checks in the mail. I think you will start seeing some legislation begin to move through Congress. There are bills that would establish a public option that were introduced in the last session, and I think that they will be introduced again. We'll start having hearings. So I think it's just a process. I think that you will see that later on. And I think they probably learned some things from the early days of the Obama administration when they came right out of the gate trying to reform the healthcare system, and it was problematic. So I think they learn, but I do think there's no doubt that we will see the Biden administration fulfilling its campaign, or the president's campaign promise of moving to establish a very viable and robust public option.
And what would a robust public option look like? I mean, look, I'm a Medicare for All supporter. I know you are as well. But a public option would certainly be an improvement over the situation we have now. It's something progressives pushed for in the Obama administration, but ultimately that administration decided not to push forward with a public option. So, look, there's a lot of different ways you could ultimately do this. And I'm sure that these same groups we're talking about now are going to be working aggressively behind the scenes to try to water the public option down so that it's basically an option that nobody ultimately wants to take advantage of. What are some of the tricks that we should be looking for?
Among the tricks will be to try to make sure that it is not administered by the Center for Medicare and Medicaid Services, or CMS. It's essential that it be a true public option administered by CMS, just like the current Medicare program is, which is, of course, a public option. And people who are Medicare beneficiaries have the option of selecting a private plan if they want to. So my argument is, why should the industry be against making that available to everybody? It cannot be a Medicare Advantage public option. In other words, Medicare Advantage plans are the private version of Medicare, and insurance companies have figured out how to make that a big cash cow. They are profiting from taxpayers, so it cannot be a Medicare Advantage-based plan. It has to be open to a lot of people. What we saw a dozen years ago was that it was whittled down, as you noted, to the point that it was going to be available only to a few people. And it has to be a plan that has minimal or very low deductibles. One of the big problems with private insurance plans is that insurers have been jacking up out-of-pocket costs so much that people with insurance can't use it. Deductibles have risen 111% in just the past 6 years. So we don't want that, for damn sure.
Yeah, really interesting, Wendell. Thank you for your analysis.
Thank you.
Next on Rising, friend of the show Ryan Grimm, he joins us to discuss Tara Reade's latest battles when Rising continues.